Wichita Falls, Wichita County Public Health District began preparing for this crisis in late December when the World Health Organization started releasing information specific to COVID-19. Now, Director of Health Lou Kreidler and Assistant Director Amy Fagan are joining us now to discuss how they've managed this ever-changing environment. And thanks so much, you two, for joining us. Amy, let's go ahead and start with you and take us back to March 18th when Wichita County had its very first case. How did the health district's response to the virus evolve from that point?
So we at the health department have assembled a team of people here to assure that we can handle all the cases as they come in. We have done a very robust job of doing contact tracing and surveillance, and we have assured that those cases are fully contact traced to include those who the cases come in contact with. And I think that's been very helpful as we've managed all these cases.
You know, Lou, so many people are glad, and some not, but some are, that businesses are finally opening back up. Are you seeing an increase in the number of positive cases now that these businesses are opening back up?
You know, we've continued to see the slow trickle of 1 to 2 cases per day, and sometimes no cases. But you know, there's a 14-day lag time from the time that things begin to open up, and you see more people out in the community. So we have to monitor that with a response. It's not like things will open completely up and then the next day we'll expect to see a spike. So we've had Mother's Day this last weekend, and what we know is we had a lot of individuals out shopping, but a lot of individuals who had family gatherings and were together with their families over Mother's Day. And so, you know, we continue to watch. Everything is a new event, and we continue to look 14 days out from where we're at to see what our case burden is going to be for the community.
In the beginning of this whole thing, we were told that if you were healthy, you didn't need to wear a mask. Then we were told maybe it's a much better idea. What's the latest on the thinking there?
You know, really, each person has to weigh the risk benefits. I am an absolute believer in wearing masks, and I believe that adds an extra layer, a barrier protection from you and those that you're coming in contact with. You know, when you go into stores and you're going shopping, that social distancing is difficult at its best, and it really is an extra tool. A lot of people don't want to wear a mask, and that's a personal choice, but I think we all have to share some personal responsibility in not only protecting ourselves, but protecting others. We've seen asymptomatic spread, and so what we know is, and individuals who are testing positive who are asymptomatic. So what we know is that you can spread the disease before you show any symptoms. And so it really is everyone's responsibility to be wearing a mask and protect themselves and their families.
So what's next, do you two think, from here that we're going to see as we hopefully push toward a vaccine in this pandemic?
So, you know, the thing is, things change so quickly. I think we operate in 7-day time frames. We look to the future, so we're looking how far on the horizon is a vaccine. How far on the horizon is it before we know what will affect the vaccine or affect the virus, such as temperature or, you know, time or what have you. But I think we're working in a 7-day operating period. And for the next 7 days, we know we'll have a few more cases. We suspect that we will. You know, we really look to the community to do all that they can to maintain social distancing and all those things we've talked about in order to reduce that disease burden in our community. And I think that, you know, only time will tell. But we're going to continue to move forward as we have, and this community is amazing. When you compare us against other communities, we have done so much. I think that when we compare to other communities, it's very different. So I think everyone should take pride in that. I think we're doing a lot, but we need to continue those efforts and not let up on those reins so that we can have a nice summer.
And Lou, anything you want to add to that?
No, I just echo Amy's concerns that it's everyone's responsibility, and we really have come together as a community. You know, it's a conversation Amy and I have a lot about how positive everyone has been, whether it's when Amy's calling them or we're calling them to tell them that they've had one of their employees who is positive for COVID-19, or whether it's our stores. Early on when we were naming those stores, we didn't have any pushback from anyone when they were going to be publicized that they had someone who was positive in their location. And I think that really is a strength of the community, is that, you know, we all pull together for the good of the community, and that really makes a difference.
Okay, that'll be the last word. Thank you both very much for joining us.
Thank you.
Thank you.